and basically my presentation would consist of two stories actually, because I want to make it interesting. I know it's a post-lunch session, and we are on the midway of the conference, so I don't want you to lose your morale and momentum actually. So I have the fortunate of working in a hospital which is surrounded by a lot of nightclubs, one of them being shown on the slide. And sometimes I feel unfortunate also, because the places which I visit, I never suspect or never feel that my own colleagues which dance on Munni and other tones would end up in my same ICU actually. So we have a special interest in poisoning, and we used to work in peripheral area, and we used to encounter a lot of organophosphorus. But unfortunate thing is that not only it's the rural India, but you can see here in the metropolitan, the capital city of India, you can see here that this is a paper we presented, that 10% of all admissions in a tertiary care center like us, and we even if you see Delhi, we practice in the southern part, in the South Delhi part, 10% of admissions in our ICU are composed by poisonings actually. This is one of the unfortunate patients actually, but fortunately he survived actually. This is a 25-year-old male, actually owner of one of the city walk actually shop. He went to a late night party and had some consumption of alcohol. Probably the girlfriend actually accompanied in the ER. So we have a different scenario. Here is not somebody who is, say, who's crashed down, but most of the, because nightclubs are just, say, half an hour drive from the hospital. So the girlfriend accompanied and said he had consumed excess alcohol, and he said, I suspect that there may be a co-ingestion of cocaine. And if you see the slide, actually I didn't focus on that, but in the study which we did, we had clearly shown that most of the times we have co-ingestions. Alcohol is one of the components which is persistently present. When he came to the ER, he was drowsy but hemodynamically stable. The heart rate was 90 and BP was 150/100. But the striking point was that the pupils were small actually. So we could have believed, because we know that we can trust the girlfriends, but at this point of time I was a little skeptical, because if the patient would have consumed cocaine, I would have thought the pupils would have been dilated, but the pupils were small. And he was talking actually, he was a little restless. After 15 minutes in the ER, he developed altered mental status and actually went into coma, was hypoventilating, intubated and shifted to the ICU. The striking thing was that after this story, when he landed up in the ICU, after 2 years he was conscious and he was asking for the removal of the tube. Urine tox screen which was done, and it comes within 1 hour, and we have 5 components which are tested in the urine toxicity screen. Was positive for cocaine. Unfortunately or fortunately, we decided not to extubate, but he was so conscious that he was asking, he was in fact begging, just remove this tube. So we did not extubate. We extubated him next morning, discharged after 48 hours. We don't know the diagnosis. We don't know what antidote to give. So we just a supportive care. But what could be the diagnosis? Anybody, any guesses? Anything which has shorter duration of action, patient gets conscious after some time. Alcohol? So we'll discuss in the hemodynamics. I showed you the hemodynamics. I know Dr. Dhruv is here, so I have to be very particular. The heart rate is 90, the blood pressure is 150/100. Cocaine?
Fentanyl?
Fentanyl. He's coming from a nightclub here. Let us keep it as a mystery and we'll discuss it later. This was, I don't know whether it was a GHB, because Dr. Dhruv is here. Unless I have an evidence, I will not speak it is GHB. But it looked like GHB actually. The typical presentation of GHB, and I'll just show you. Typically GHB will present with respiratory and CNS depression. And most of the clubs, and I have friends who run these clubs, they tell us that this is the drug which is being, because it gives a different feeling actually. it looks like a very safe drug actually. It has got a sweet taste, so it mixes very well with the alcohol. It causes obtundation, gives a very good feeling. You can dance till the late night, but sometimes unfortunately if you overdose it, you may get landed into coma. But the good thing is that there is a good recovery actually. It is a very short lasting drug actually. So there is a debate actually whether these patients should be intubated or we should have a little higher threshold for intubating such patients. And that is why if we feel and if we have a high index of suspicion in these patients, I think most of the literature suggests that please have little higher threshold for intubating these patients and try something. Unless the airway is compromised, try an IV or something to just tide over the crisis actually. So these are the major club drugs which I think you should not get interested, but these are actually served in the nightclubs actually. Although they are banned, but I can tell you, and I have got a lot of evidences to support that most of the nightclubs use one of these drugs in the drinks which they serve actually. And it is not only, you can see here.
Can you tell us what's GHB? Pardon me for my ignorance.
It's gamma hydroxybutyrate.
Okay.
Yeah. And you can see here, even in newspapers, there are a lot of articles. You can see here, over 2 years, several foreigners have been arrested for peddling cocaine in the city. And this is about New Delhi actually. What about Bombay? You can see here, fatty pear packets. Fortunately, doctors don't have. Higher stress, we fit into that category. Peer pressure. These are some of the reasons for rising cocaine consumption in India. So cocaine consumption is going up actually. And you know about this incidence actually, and we know that it's not, which is not there in the media. We know about this case also, and this is a very interesting case actually. This is an eye-opener for all of us, and I visit to court many times because of my interest. Unfortunately, all these patients are MLC cases, so we have to go to the court actually. So we need to understand toxicology at its best if we want to practice toxicology. Cocaine typically fits into that sympathomimetic toxicodrome, will cause agitation, psychosis and these things. So, but you need to exclude from other sympathomimetic drugs actually. These are some of the other drugs which can say mimic cocaine. Important point is that it can cause seizures and it can cause say myocardial infarction and ischemias actually. It can cause hypertensive crisis and tachycardia, which may look like pheochromocytoma. Young patient coming with escalated hypertension, hypertensive encephalopathy, and some kind of ischemic changes in the ECG would always rule out cocaine in this group of patients. This is very important actually, because all patients with poisonings are medico-legal cases. You need to know what to send and when to send actually. Otherwise you will end up in a big trouble actually. It's difficult, and I have faced one of the narcotic cell judge, very difficult actually. He will ask questions you will never be able to answer. He asked me a very important question. He says, "Doctor, your toxic screening showed cocaine, but what is the sensitivity specificity? What is the cross reaction with other poisoning? The family is denying, the patient himself is denying he's never consumed cocaine. You are trying to prove that he has consumed cocaine. Prove it. Not very easy. So you need to know when to send and what to send actually. But there are certain rules of the toxicology. If you follow the rules, then you will never be in the trouble. Important point is always send urine and blood. Maybe there are certain poisons which are where serum levels are important, but always can send urine for screening actually. Communicate with the lab and the pathology. Very, very important. Unless you tell the lab that you are suspecting a particular poison, and I remember a patient who used to work in saloons, came with ingestion of some kind of a dye. And then he had a lot of other multi-organ dysfunction, and we could not come to any conclusion. We didn't know what he consumed. The only finding was that the chloride levels were very high, 150, 116. Then I called up the lab that what is the cause of high chloride levels. And then when we checked in the components of the hair dye, it contains a lot of bromide actually. And bromide and chloride is very difficult to differentiate in the lab. So it is very important to communicate to the lab what you are looking for actually. Send specific drug levels if indicated. But you should know when to send samples. If a patient comes with paracetamol poisoning, don't send the sample immediately. It takes 4 to 6 hours for the serum levels to get achieved actually. So you should know, and it is very important. If you know the levels, then you can decide whether to continue, say, antidote or not. Important point again, never, a negative screen does not equal to negative exposure actually. So never disclose the family or write in the file that this patient does not have poisoning, because there is very limited testing available for poisoning. Rely on the clinical picture and be aware of various cross reactions between different poisonings. Like flunitrazepam is a benzodiazepine, but benzodiazepine, if you do a strict urinary toxic screen test, will be negative, because flunitrazepam unfortunately doesn't get picked up in the urine sample. MDA, GHBs will not be picked up in the urine actually. You know about this story actually, and you read the sentence and you will come to know that how difficult it is actually. You can see the sentence which was given in the toxic screen that we have done. We found all the levels to be negative or within normal limits. Don't use that term. There is nothing like normal cocaine level in the blood. So you have to be very selective when you interact with the patient family or with the media actually. In the standard testing, we did not find any levels that were in the abnormal range. We did not say that this means there was no ingestion of any sort. We can't comment on that. So these kinds of things will actually land up in problem. So you need to understand, and people who understand poisoning should only give such kind of comments actually. These are some of the samples which can be sent, and cocaine, you can see cocaine in the urine in 6 hours actually. Most of the patients will have some kind of EC changes, and the good thing is that you can differentiate whether it is cocaine or not by doing CPK and troponin I. CPK will be high, but troponin I is not affected with cocaine actually. And this is a confusing slide, but it's the most important slide actually. You can see here there are a lot of confusing. There is an initial test and a confirmatory test in cocaine. So do not comment on cocaine whether it is positive or negative, because it's a difficult thing. There is no standard, because I don't know how things are, but the lab is not very certain in saying that whether it is cocaine or not. So it is better to not comment on the lab testing actually. So lab testing is only for clinical application and not to be disclosed to the media or written in the file actually. Treatment is standard. You give sedatives, benzodiazepines, you can use nitrate. The important point is avoid pure beta blockers. Always use, as in pheochromocytoma, always use alpha and beta blockers, a drug like labetalol, to control blood pressure. This is a very important drug, and I didn't know about it unless a friend of mine who likes the nightclubs very much actually, he asked me, sir, I want a prescription of this drug. Then I checked out what is this drug actually, and it is available in India. It is available, and in the nightclub language it is used in some different names actually. It is a fantastic benzodiazepine actually. It gives a different feeling from alprazolam. Alprazolam will cause sedation, but nitrazepam sometimes causes a different sort of feeling which you feel like going to a club actually. Good thing is that even if you give to your girlfriend or your colleague, it doesn't get picked up in the urine. So nobody, neither Dhruv Chaudhary nor me, Dr. Peter, nobody will say that this patient has consumed nitrazepam. So this will not be picked up in any sample actually. Ecstasy, there are different names, including lover speed. So they are in promotions actually. Like you must have seen the antibiotic name, like some kind of, they use different names as if it is a fantastic drug. So these drugs are also marketed in different names actually. The primary effects, 3 to 4 hours, patient may crash if you overdose within 2 to 6 hours. Hangover may last for. Do not prescribe this drug. This is the only drug you should get away from it actually. It does not mean that I am promoting other drugs, but the thing is that this is a drug you should be really careful with, because there is a post-MDA depression. Acute toxicity will lead to hyperthermia, rhabdomyolysis, cardiac arrhythmias, and multi-organ dysfunction. Hyponatremia, subarachnoid hemorrhage has been known with this drug, cerebral infarction, and bleeds are known with ecstasy and other. And this is something called Suicide Tuesday actually. I don't have a music here, but I can show you a music, the kind of feeling you have. So what happens is when you use this drug on say Saturday evening, you will have a great feeling for 24 to 36 hours. By Monday you will be very depressed when you go to the office. By Tuesday you will feel very depressed and again feel like you are very depressed and you will take another drug actually. So please do not use this drug or advocate this drug to anybody. So it is called Suicide Tuesday. So Tuesday people may actually end up in such a depression that they may consume another drug actually. Unitoxicity fails to detect MDA. Again, not a good thing actually.
I think we're running short of time.
Yeah.
Can you summarize?
Yeah, I'll just summarize. I'll show you another case which is very important. This is a girl who came to our ICU recently actually, and she wanted to commit suicide because she fought with the boyfriend who had another 2 girlfriends actually. So the problem was not with her actually, was with the boyfriend. And he took actually Googled the net and find out that digoxin is a very great drug to commit suicide. So she took a large dose of digoxin, around 70 tablets of digoxin, and these were the clinical findings. Typically yellow vision actually, and when I read in the book, it was described that the yellow vision is known with that. Had some AV blocks. These were the initial digoxin levels 12 and 10.3. This was the ECG in the ER, which was absolutely normal. This is the ECG when she came to the ICU actually, and after 2-3 hours she started developing some PR blocks. Although she had just complaints of vomiting, and this is the unfortunate part. Patient with digoxin poisoning doesn't look sick actually. They just complain here. They have vague complaints. And after a few hours, actually developed AV dissociation, and temporary pacing had to be done actually. Then we paced her actually. She looked okay, but we had to do a temporary pacing on this patient. We did a temporary pacing here when we thought we gave charcoal. We thought of giving digoxin antibody. It was not available. These are some of the treatment modalities. There is something very particular that do not shock these patients actually, because they may actually end up in asystole even if they have VT or VF. Try magnesium, lignocaine and other drugs. Calcium is contraindicated, and these are some of the protocols. This is what has been advocated. You can use multi-dose charcoal. But the important point is that, and this is a textbook which I read actually, I carry with, and it is there in our ICU. I was looking at options that the way digoxin levels were so high, and digoxin being it's not lipid, it does not high affinity for lipid, and it's not highly protein bound, it's not dialysable. Charcoal hemoperfusion is not a very recommended measure, but you can see here, this textbook actually mentioned that actually. You can see here. And this is a text, and then we decided to do charcoal hemoperfusion, and these were the labels pre and the post filter, and the patient improved actually. And so there's something actually, toxicology is not a very well studied science, and sometimes things which we need to see what is available, like Dizibind is a drug which is a standard of care. But Dizibind being not available and charcoal hemoperfusion being studied only in selected cases actually. But in this patient it worked. Thank you so much.